trust relationship with a provider where they have an opportunity to voice concerns when they're minor. Our system isn't developed to support low-income people or the working poor to have access to those services. Right now, we wait. Our system is really structured to incentivize them to wait until conditions are very serious or potentially an emergency, and then they access the healthcare system. And all of us still pay for that care when that happens. It just happens in the most expensive possible way. I think expanding Medicaid is a really good way to support primary care in the state. We want patients to stay home. We want them to stay in the state. We don't want them to seek care out of state. If we allow them and create a system in which they can find that care locally at a more affordable rate, they can stay home. If we wait until conditions are far more serious, and often is the case that they need subspecialty care that we don't provide in our state due to a low population. And so by not really seriously considering expansion as a means to create a primary care infrastructure that really focuses on preventive medicine, we push patients out of state in some cases because they have to go elsewhere to seek far more specialized treatment as their conditions worsen. So with that, I will close. I appreciate your time. If there are any questions, I would stand for those.
Questions, committee? Senator McEwen, let me say that right. I said it wrong again. Go ahead, sir.
Thank you, Mr. Chairman. We find ourselves in this situation, and it kind of angers me. And it's nobody in this room's fault. So my question is, when does it end? In 2007, 2008, I bought a grocery store. We offered health insurance to the lower class working people. Then some guy came along and invented a law or a new healthcare system that was going to be better, which literally made what we were doing illegal. We could no longer offer health insurance because they wanted them on the federal system. So while I think this is a great plan, my other question is, what are the strings attached to this from the federal government? Having served in the Army and living overseas, I'm going to tell you, you don't want socialized medicine. I saw it, and it's bad in my mind. So in Senator office, that was a great question. What do we do? I don't know how we get the federal government out of the healthcare business, but that would be my answer. And I don't know if we can. So as we look at this, when does it end? Are we going to have federally run hospitals? And really, that's my question and the point I want to make, so you don't think I'm an absolute ogre later. Thank you.
Thank you, Senator McEwen. A simple question. Go ahead and answer that, Ms. Bush, if you would like.
Mr. Chairman, Senator McEwen, I recognize and appreciate the concern. I think healthcare right now, it's a little broken, and we all can be on the same page with that. We just, the real questions come in how we fix it and getting to the same page together. I think it's probably a patchwork quilt where everybody has a role to play. There's personal responsibility that needs to be a component. It's a multitude of factors. Right now, with what we have today, we think that this is a really positive step forward in that patchwork quilt. We don't think it's the end point. We think it's one small step towards something bigger. And it's not an effort, excuse me, at least in our state, to move into a fully socialized program or the federal government running all of our hospitals, not in any way. It really is just with what we have today, with the resources that we've been given, how do we hold our state together in our current economic crisis? How do we support healthcare? It's probably not perfect. In fact, I'm positive it's not. But it's what we have today, and we think it's the best answer available to us.
Further questions? Go ahead, Senator McEwen.
And I empathize with that, but it seems like we're headed down a slippery slope. It might fix it now, but at what cost? And I'm not necessarily against the bill. It's just, when do we say enough's enough? If that makes sense. Thank you, ma'am. Thank you, Mr. Chairman.
Mr. Chairman.
Go ahead.
Senator McEwen, I hear you. I think what we have right now, though, we're already in some ways there. And I think that sometimes it's difficult to recognize that the system we have today that isn't up for decision at all already forces our hand to care for people. It's just that we do it in the most dysfunctional and the most expensive way possible. And so is that great? Do I think it's perfect? No, not at all. But if we take the system and look at the reality of what it is right now and how broken it is, this is a means to at least start attempting to fix it. And it might be a roundabout way, and it might be counterintuitive to core beliefs that we expand in order to address the problem. But I do truly believe it's there. And in my 15 years of healthcare policy work, the more you learn, the more you scratch your head. And it's just the reality of where we are. But it's already a system where we pay for those services. We're already obligated as a country because of laws passed in the 60s to provide this care and to do it out of our pockets. This is just a way to do it in a far more affordable and truly more humane way in giving people the care they need early when it's more affordable.
Thank you. Further questions, committee? No further questions.